People from out of state can now travel to Arkansas after more restrictions were lifted today by the governor. Thanks so much for staying up with us tonight. I'm Marlisa Goldsmith. THV 11's Marlisa Goldsmith shows us who is allowed in and what this could do for the hospitality industry.
Yeah, many of the hotels here in downtown Little Rock had to lay off dozens of workers and in some cases even completely shut down. But I'm told they're excited and ready to welcome back tourists again.
It's been very, very quiet, about half of what we usually do.
Stephanie Ferguson is the director of sales for McKinnon Hospitality. The company owns 4 hotels in the River Market, one of which had to be shut down.
Unless they were coming in for very specific reasons, we had to turn people away.
Tuesday, Governor Asa Hutchinson lifted the out-of-state travel restrictions, a relief for Ferguson.
We're excited to be not turning people away anymore.
People traveling from hotspots like New York City and New Orleans are still not allowed to travel in-state.
You would have to essentially quarantine in place for 14 days.
Stacy Hurst, the Secretary of Parks and Tourism, is working with hotels and state parks to ensure they do not take reservations from people in these areas.
They make that reservation online. We will have to follow up with a phone call or an email to let them know about the new restriction.
All other out-of-state travelers will be allowed to camp in an RV in all state parks. Tent camping is still not allowed for anyone.
But we are looking at that for the second phase.
Ferguson is working to ensure her staff are deep cleaning after every guest.
Hilton recently announced that they're going to be using Lysol, partnering with Lysol starting next month.
And she is hopeful the tourism industry will bounce back eventually.
And I don't think it'll be this year, unfortunately, but hopefully in the next 12 to 18 months.
In Little Rock, Marlisa Goldsmith, THV 11 News.
Marlisa, thank you. This citywide curfew in Little Rock is changing. Listen up. Tomorrow, the current 9 p.m. to 5 a.m. curfew will be replaced with one that runs from midnight to 5 a.m. The city also announced it hopes to totally do away with it by May 21st. As for the daytime curfew for minors, that will remain in effect until May 27th. So here's a recap of the changes from over the last week. With certain restrictions, places of worship, large venues, and gyms can all be open now. Starting tomorrow, barbershops, salons, and tattoo parlors can reopen with restrictions in place. And Arkansas restaurants can resume limited dine-in services next Monday.
24 hours ago, I was watching scattered storms move into central Arkansas as the cold front was slicing its way through the state. Tonight, though, it's all quiet. Beautiful near full moon taking place right now under mostly clear skies, and the temperatures are dropping. Check them out. It's 52 in Clinton, 64 in Hot Springs, 59 in Mena, and 63 in Pine Bluff. The winds are light to calm. We've got that less humid air building its way in here. Thanks to those breezes from the north-northwest, dew points into the upper 40s to lower 50s. So guess what? We're going to start off our Wednesday morning into the upper 40s to lower 50s. We'll see plenty of sun. It's going to be a beautiful Wednesday all throughout central Arkansas, and temperature is actually below average. Rain chances move back in on Thursday into Friday. That's another cold front, and that's going to bring in some unseasonably cool temperatures for the weekend. More on that coming up.
Nathan, thanks so much. Here's where we stand tonight on the COVID-19 pandemic in Arkansas. Of the more than 3,500 total cases reported, only 1,400 are active cases because more than 2,000 people have recovered. That's good news. Unfortunately, our state still continues to see deaths. We're up 2 from yesterday, bringing the death toll to 83 in Arkansas. Did the CDC lower the national COVID-19 death count by nearly 30,000? That's the claim popping up on a lot of social media posts, and we've had our Verified team checking it out. Here's our Jason Puckett.
Multiple claims say the CDC lowered the number of COVID-19 deaths from 55,000 down to about 37,000 deaths. They all link directly to the CDC website as proof. So is this true? Our main source here, the same CDC pages being shared. As of Monday, the CDC shows 67,456 deaths from COVID-19. But a separate CDC page shows a total of 38,576 COVID-19 deaths. So 2 CDC pages with a difference of 30,000 deaths. What's going on here? Did the CDC change their numbers, or is one of these numbers wrong? No, the numbers on both pages are accurate. One is just a few weeks behind the other. The same page being shared in the viral claims explains the difference. This 67,000 number is the total reported to the CDC by states. Each state counts their death certificates and sends a report on COVID deaths to the CDC. But this smaller number comes from a second check of the death certificates that states send to the National Center for Health Statistics, or NCHS. And here's the key point. Since they have to get these certificates from each state and then process them again, their data, quote, often track 1 to 2 weeks behind other data. And that matches up. CDC archives from about 2 weeks ago show about 39,000 deaths reported by states. So we can verify these claims are false. The CDC didn't lower or revise the COVID death count. They have two separate counts. One is a direct current report from states. The other is a second count of death certificates that's a few weeks behind. If you're seeing more claims like this out there, send us an email. With your Verify, I'm Jason Puckett.
President Donald Trump says the coronavirus task force will be winding down soon, though he'll continue to take advice from his top health experts.
Mike Pence and the task force have done a great job, but we're now looking at a little bit of a different form, and that form is safety and opening, and we'll have a different group probably set up for that.
Less than a week ago, researchers from the University of Washington predicted 72,000 Americans would die by August 4th, but now they warn that number could sharply rise to 134,000 if strict measures like social distancing are eased. An Arkansas nurse is back home tonight after she spent the last week in Georgia helping out on the front lines. She spoke with our Mercedes McKay about what she saw and the main message she wants Arkansans to hear.
I love you to the moon and back and the sun and back forever and ever, amen.
This is LaDonna Young saying goodnight to her 5-year-old daughter before one of her night shifts at a hospital in Albany, Georgia.
There's different ways to approach COVID as far as diagnosis and treatment, and I kind of wanted to go and get a different idea of how it's being treated and handled to help my patients here in Arkansas.
Leaving her nurse practitioner role at the Medical Center of South Arkansas in El Dorado to help out as an RN in what some call a coronavirus hotspot.
It was almost like when I went in there, it was a war zone. It was almost like if you've ever watched The Twilight Zone, it was like an episode of The Twilight Zone.
Taking care of patients young and old while slowly watching them get sicker. These memories that Young describes as too painful to put into words.
It was kind of like you do your best you can, but unfortunately sometimes that just wasn't enough.
The state of Georgia teaching her one main thing. Everyone needs to be aware that this virus hasn't gone anywhere.
Just because we're opening the state doesn't mean that it's gone, and we don't need to forget about it.
Wanting to bring these lessons home, Young packed her bags to come back and help Arkansans.
Since I did go, a lot more needs done here than I realized in preparation for what I think is, kind of the next surge of COVID patients.
This next wave that she wants everyone to be mindful about as closed signs flip to open.
Don't forget everything we just learned. Don't just wake up and pretend it's not there, because it is.
Mercedes McKay, THV 11 News.